think it's a very interesting study that looks back at patients who have gotten treatment for head and neck cancer, and they were really trying to understand who should get the most intensive therapy. And the surprising part of the finding was that they found quite significant differences in the treatments received by men and women, where women received less intensive chemotherapy, less intensive radiotherapy, and had a higher risk of dying from cancer than men did. We don't necessarily know exactly why that is. This is an interesting new finding that requires further exploration. I would have expected that the treatments and the intensity of the treatments received would have been equal. There may be some things that they hadn't controlled for related to HPV status. There may be other factors that could explain this, although their mathematical modeling accounted for many of those factors. And so it's surprising that there were such dramatic differences in the intensity of treatment received. The GCE model that they use, that has been validated in other cancers, accounted for the different treatment sites. And so theoretically, that should not be a factor in the differences that we see in the treatments received between men and women, because their model specifically tried to account for that. But until they go back and do their full chart review, I don't feel I can answer that with certainty. So HPV has been a relatively recent finding that is different between men and women. It is more associated with oropharyngeal cancers, so cancers of the back of the mouth and throat, are more likely to have HPV positivity. Men are more likely to have those cancers than women, and the prognosis is generally better among HPV positive patients than non-HPV positive patients. So there may be a correlation between that HPV positivity and some of the survival outcomes that we see. But what we don't know is, does that fully explain the differences in treatments received? And does it explain the differences in likelihood of dying from head and neck cancer?